Hi, Mitch here, the retired pharmacist with another video on preventive health. I decided this time to talk about a health issue that was brought up at dinner with friends. The loss of smell and taste, acute and chronic, from COVID-19. Smell is linked to emotions and memory. It works with the sense of taste to give us flavor. The loss of smell is called anosmia and is an extreme case of olfactory dysfunction. About 50% of people with COVID-19 acquire the loss of smell and taste. The loss of taste is called ageusia. The loss of smell leads to perceiving a loss of taste. The loss of smell in COVID-19 is not totally understood, but believed to be caused by cell damage to the olfactory neurons in the cells supporting the olfactory outer protective layer. These cells can regenerate because they originate from your stem cells, which are olfactory specific. The average time for smell and taste to return is 21 to 28 days. 10% of people experience permanent loss. The severity of COVID-19 symptoms cannot be predicted by loss of smell, but sometimes this is the only symptom that they have. Smell training is a new idea that they came up with to try to get these senses back. It's being used to help recover the olfactory sense. The essential oils of lemon, rose, clove, and eucalyptus are mainly being used. Saline flushes that most people know about and nasal steroid sprays may help in the first few weeks of nasal olfactory inflammation, but tend to fail for chronic olfactory loss patients. Smell training consists of sniffing the same 4 scents of essential oils for 20 seconds on each scent every day. Cinnamon, chocolate, coffee, lavender, honey, strawberry, and thyme oils are also being used. This type of smell training has shown improved nasal function and possibly regenerating those specific stem cells involved in smell and taste. I now want to talk about my favorite subject, which is brought up in almost every one of my videos. That's why I believe in antioxidants, and that is the benefits of antioxidant anti-inflammatories. A recent study was performed using alpha-lipoic acid 600 milligrams per day on an empty stomach for about 4.5 months. This supplement's possible mechanism of action includes antioxidant, anti-inflammatory action. It also releases nerve growth factor, NGF, which may help the specific olfactory stem cells to regenerate the olfactory neurons. 70% or 16 patients out of 23 showed a significant improvement in olfactory function after 4.5 months. The next antioxidant anti-inflammatory I want to discuss is Astaxanthin. This supplement reduces elevated levels of interleukin-6 and tumor necrosis factor to prevent respiratory distress syndrome in COVID-19 patients. Astaxanthin is found in algae and seafood and is talked about as 6,000 times more powerful than vitamin C. Again, we are decreasing damaging free radicals and increasing the immune system. Again, we can only speculate, but we should see a significant improvement in olfactory function within a few months of taking this supplement. This supplement, via its antioxidant strength, should stimulate the olfactory stem cells to help regenerate the olfactory neurons. The dose, 12 milligrams per day with food. Pycnogenol is another antioxidant anti-inflammatory, which is derived from the pine bark tree. The supplement has very strong anti-inflammatory endothelium protective effects in supporting recovery and reducing long-term negative effects from COVID-19. Again, we should see a significant improvement in olfactory function within a few months of supplement use. The dose is 100 milligrams once or twice daily with food in the form of French maritime pine bark extract. In another video of mine on COVID-19, I talked about other antioxidants, vitamins, minerals, and probiotics to help prevent COVID-19. The list was as follows: zinc, vitamin D, vitamin C, quercetin, turmeric, and probiotics. All would be helpful in regeneration of the olfactory neurons. I believe there are many, many more antioxidants that could help prevent and improve COVID-19 outcomes, but too many to list and discuss. Thank you for watching and listening to my video. If you enjoyed the content, please give me a thumbs up and subscribe to my channel. Mitch the Retired Pharmacist, signing out.